As we navigate the complex world of medications, it's crucial to understand the potential interactions between the drugs we take and the foods we consume. One particular dietary component that often raises concerns is eggs, a staple in many households worldwide. In this comprehensive video, we'll delve into the reasons why you should exercise caution when combining eggs with certain medications and explore the potential consequences of such interactions. Eggs are a powerhouse of nutrients, providing an excellent source of protein, vitamins, and minerals. However, their unique composition can interfere with the absorption, metabolism, and efficacy of various medications. By gaining insights into this intricate relationship, you can make informed decisions to safeguard your health and ensure optimal treatment outcomes. Overview of common medications that interact with eggs. Numerous medications have been identified as potentially interacting with eggs, spanning various therapeutic categories. Some of the most notable examples include antibiotics. Certain antibiotics, such as tetracycline and fluoroquinolones, can form insoluble complexes with the calcium present in eggs, reducing their absorption and effectiveness. Cholesterol-lowering drugs. Medications like cholestyramine and cholestyramine can bind to the cholesterol found in egg yolks, diminishing their ability to lower blood cholesterol levels. Thyroid medications. Eggs contain compounds that can interfere with the absorption of thyroid medications, such as levothyroxine, potentially leading to suboptimal treatment outcomes. Blood thinners. Warfarin, a commonly prescribed blood thinner, can be affected by the vitamin K content in eggs, potentially altering its anticoagulant effects. Diabetes medications. Some diabetes medications, like metformin, may have their absorption impacted by the protein content in eggs, potentially affecting blood sugar control. Explanation of how eggs can interfere with medication effectiveness. The mechanisms by which eggs can interfere with medication effectiveness are diverse and complex. One primary concern is the binding of certain medications to components found in eggs, such as proteins, minerals, or vitamins. This binding can reduce the bioavailability of the drug, meaning less of the active ingredient reaches the intended site of action within the body. Additionally, eggs can alter the absorption rate of certain medications by affecting the pH levels in the gastrointestinal tract. Some drugs require specific pH conditions for optimal absorption, and the presence of eggs can disrupt this delicate balance. Furthermore, the high nutrient density of eggs can compete with certain medications for absorption sites in the intestines, leading to decreased drug uptake and potentially compromised therapeutic effects. Potential risks and side effects of combining eggs with specific medications. The consequences of combining eggs with medications that interact can vary depending on the specific drug and the individual's health condition. Some potential risks and side effects include reduced therapeutic efficacy. The interaction between eggs and certain medications can lead to a decrease in the drug's intended effects, potentially rendering the treatment ineffective or suboptimal. Adverse reactions. In some cases, the interaction may result in unexpected adverse reactions, such as gastrointestinal disturbances, allergic responses, or exacerbation of existing medical conditions. Toxicity. Certain medication-egg interactions can increase the risk of drug toxicity, as the altered absorption or metabolism of the medication can lead to higher than intended levels in the body. Nutrient deficiencies. If the interaction impairs the absorption of essential nutrients from eggs, it can contribute to nutrient deficiencies over time, potentially leading to various health complications. Alternative food options to consider while taking these medications. While avoiding eggs may seem like a straightforward solution, it's essential to maintain a balanced and nutritious diet. Here are some alternative food options to consider while taking medications that interact with eggs. Plant-based protein sources. Legumes, e.g., lentils, beans, and peas, tofu, tempeh, and plant-based meat alternatives can provide a good source of protein without the potential for medication interactions. Dairy products. Milk, yogurt, and cheese can be excellent alternatives for obtaining protein, calcium, and other nutrients found in eggs. Whole grains. Quinoa, brown rice, and whole wheat products can offer additional protein and fiber to your diet. Nuts and seeds. Almonds, walnuts, chia seeds, and flax seeds are nutrient-dense options that can complement your diet while avoiding potential medication interactions. It's important to note that some individuals may need to exercise caution with certain alternative food sources as well, depending on their specific medication regimen and health conditions. Tips for managing medication and dietary restrictions. Navigating the complexities of medication-food interactions can be challenging, but with proper planning and guidance, you can effectively manage both your dietary needs and medication regimen. Here are some helpful tips. Read labels carefully. Always review the medication labels and package inserts for any specific dietary instructions or warnings regarding potential interactions. Consult with healthcare professionals. Discuss your medication regimen and dietary preferences with your healthcare provider, pharmacist, or a registered dietitian. They can provide personalized guidance and recommendations based on your unique circumstances. Time your medication and meals. In some cases, separating the timing of your medication intake and egg consumption can help minimize potential interactions. Keep a food and medication journal. Maintaining a detailed record of the medications you take, the times you take them, and the foods you consume can help identify patterns and potential interactions. Explore alternative medication options. If the interactions between your current medications and eggs are particularly concerning, discuss alternative treatment options with your healthcare provider. Stay informed. Stay up to date with the latest research and guidelines regarding medication-food interactions, as new information and recommendations may emerge over time. Importance of consulting with a healthcare professional. While this video provides valuable insights into the potential interactions between eggs and certain medications, it is crucial to emphasize the importance of consulting with a healthcare professional before making any significant changes to your medication regimen or diet. Your healthcare provider, such as a physician, pharmacist, or registered dietitian, can provide personalized advice based on your specific medical history, current medications, and overall health status. They can assess the potential risks and benefits of any dietary modifications and guide you in making informed decisions that prioritize your well-being. It's essential to maintain open communication with your healthcare team and promptly report any adverse reactions or concerns you may experience. By working closely with professionals, you can ensure that your medication regimen and dietary choices are optimized for your individual needs and circumstances. Case studies and examples of medication-egg interactions. To better illustrate the potential consequences of combining eggs with certain medications, let's explore some real-world case studies and examples. Tetracycline in eggs. A patient taking the antibiotic tetracycline for a respiratory infection reported experiencing reduced efficacy and prolonged symptoms. Upon further investigation, it was discovered that the patient had been consuming eggs regularly during their treatment course, potentially interfering with the absorption of the antibiotic. Warfarin and egg consumption. A patient on long-term warfarin therapy for a heart condition experienced fluctuations in their blood clotting levels. After careful review, it was determined that the patient's inconsistent egg consumption, which is a source of vitamin K, was contributing to the variability in their anticoagulant response. Levothyroxine in egg-based breakfast. A patient with hypothyroidism reported experiencing fatigue and persistent symptoms despite taking their prescribed levothyroxine medication. It was later discovered that the patient had been consuming an egg-based breakfast shortly after taking their medication, potentially interfering with its absorption and efficacy. These examples highlight the importance of being aware of potential medication-egg interactions and the need for proper monitoring and adjustments to ensure optimal treatment outcomes. Additional resources and information on medication interactions. To further enhance your knowledge and stay informed about medication interactions, consider exploring the following resources. Reputable medical websites and databases, such as those maintained by government agencies, professional organizations, or academic institutions. Peer-reviewed scientific literature and research studies on medication-food interactions. Educational materials and guidelines provided by healthcare organizations and patient advocacy groups. Consultation with pharmacists, who are experts in medication interactions and can provide valuable guidance. Staying informed and seeking reliable information from credible sources can empower you to make well-informed decisions regarding your medication regimen and dietary choices. If you're currently taking medications and have concerns about potential interactions with eggs or other foods, we encourage you to schedule an appointment with your healthcare provider or consult with a registered dietitian. They can provide personalized guidance and recommendations tailored to your specific needs and circumstances. Don't hesitate to prioritize your health and seek professional advice to ensure the safe and effective management of your medication regimen and dietary habits. Conclusion and key takeaways. In this comprehensive video, we have explored the intricate relationship between eggs and certain medications, highlighting the potential risks and consequences of combining them. By understanding the underlying mechanisms and potential interactions, you can make informed decisions to safeguard your health and optimize your treatment outcomes. Here are the key takeaways. Eggs can interact with various medications, including antibiotics, cholesterol-lowering drugs, thyroid medications, blood thinners, and diabetes medications, potentially reducing their effectiveness or causing adverse effects. The mechanisms behind these interactions involve factors such as binding of medications to egg components, alteration of absorption rates, and competition for absorption sites in the gastrointestinal tract. Potential risks and side effects of combining eggs with interacting medications include reduced therapeutic efficacy, adverse reactions, toxicity, and nutrient deficiencies. Alternative food options, such as plant-based proteins, dairy products, whole grains, and nuts and seeds, can be explored to maintain a balanced and nutritious diet while avoiding potential interactions. Effective management strategies include reading labels carefully, consulting with healthcare professionals, timing medication and meals appropriately, keeping a food and medication journal, exploring alternative medication options, and staying informed about the latest research and guidelines. Consulting with healthcare professionals, such as physicians, pharmacists, and registered dietitians, is crucial for personalized guidance and recommendations tailored to your individual needs and circumstances. Remember, proactive communication and collaboration with your healthcare team are essential for ensuring the safe and effective management of your medication regimen and dietary choices. By prioritizing your health and staying informed, you can navigate the complexities of medication-egg interactions with confidence and make decisions that promote your overall well-being.